Welcome back to Medical Experts in Football. I'm Taiwa Deshigman, your host. And today's guest is an Italian who has worked for 15 years alongside professional athletes who have competed on the biggest stages, Premier League, Serie A, and even for the Argentina men's national team during the 2018 World Cup. He's passionate about human movement and evidence-based learning. He's the osteopath and physical therapist for Champions League Finalists, Manchester City. You will learn fairly quickly his madness when it comes to flying around the world just to become an excellent clinician. However, he has yet to take those measures when it comes to dancing. Hear what his celebration was like in just the next couple minutes. I'd like to welcome you, Federico Genovesi. What are you having for dinner tonight?
I suppose pasta and vegetable and pasta for sure. This is our usual dinner.
What's an Italian food you can't live without?
Pizza, pasta, a lot. To be fair, it's difficult here in the UK. It's totally different, the food, but still good. A bit different. Of course, the Italian one is special.
Now, have you been to the States before?
Yeah, several times.
How would you compare American's pasta to Italian?
It's different. I like American pasta. I wasn't sure that was good, but when I tried it, it was okay. But it's different. I think because I grew up eating Italian pasta, I prefer that one, but maybe someone else can prefer the other one. It's still good. I think the pasta itself, that in Italy maybe is the quality is a bit better, but also the way you cook it. I like it when it's not overcooked. Maybe in Italy we use this kind of method. And
what's like a memorable childhood sports memory?
Since I can remember, I've always loved football. I always practice different sport. I like Olympic wrestling, but of course football because of the facility to play and the country where I'm from, where football is really popular. First passion, and I am lucky because once I stopped to play football when I was 20 years old, I started already to work in a professional football environment. So I make of my passion also my work. Working in that kind of environment is easier for me.
We're going to get to how you even made the jump to the professional league, but going back to your early college years, what was your dream job?
My dream was to become a football player, but once I understood that I was not able to become it, so I started to study to find a way to work in football. At the beginning, I wanted to become a fitness coach, but I changed idea when I finished the college. I had the chance to speak with one physiotherapist because I had a Osgood-Schlatter syndrome at my knee. I started to attend physiotherapy sessions and I started to like it. So I said, okay, maybe what I want to do is this. And then I started to study physiotherapy at the university.
Now, you said you attended physical therapy and you liked it. What about that profession drew your interest?
I like the fact that one guy was able to help me because it was not just because I was not able to play football because of the pain, but also during the day, during the daily activities, it was really annoying. And I was limited in a lot of things.
Today, you work as a doctor and PT in the Premier League, but you also assisted the Argentina men's national team during the World Cup in 2013. Can you tell me a misconception people have when it comes to working with professional soccer clubs?
It is amazing because of the organization, because of the facilities, and because of the responsibility that you've got to treat this kind of players. I am really lucky because when I started, I was just 21 years old. It was my favorite football team. I had the chance because I was working in a private practice where the doctor of Lazio worked as well, and he brought me to the club. I had good experience with sport people because all my practice at the university was with sport team of the army. My knowledge in terms of sport was good, and I started my daily job with professional football players. And then from there, of course, watching the other professionals working and attending several courses and knowing all the good professionals, because I used to send email to go to watch other people working and just to learn to become better and to improve day by day. And at the end, I had the chance to live amazing experiences, and I became the head of physiotherapists in the next team at Palermo. I improved my skills in terms of leadership and management of the staff. And then from there, because of the experience, 10 years of experience in football, I had the chance to come here in Premier League, where amazing players. And of course, because some good players play here, I had the chance with them to go to the World Cup, because some players were asking myself to follow them. And I joined the Argentinian national team staff for the World Cup of Russia. Hopefully there will be other amazing experience for me in the future.
Now, along that entire journey, what is something that took you by surprise? Maybe you didn't expect to see or experience?
Nothing in particular. What I have seen is that better players, for example, in the team where I'm now, where I'm working now, I think they are more addicted to the work to be professionals than players that play at lower levels. For example, players that I've met here at Man City that join the top of the football, I think they are more professionals than certain players that play in the lower leagues. I was always thinking maybe everything is related with the talent, but then I understand that the talent is good, is important, but if there is not behind the talent the attitude and to become the best, to improve, you will not reach the best level. So I translate this even in my job, and I keep studying, I keep reading, and I keep myself updating with the scientific literature, doing a lot of sacrifices. But I know that to be at the top, it is important to study a lot for ourselves, to practice a lot, to attend courses, to speak with the best people in the world in terms of our job.
And we're going to get to the schooling portion a little later. But you said you noticed that players, like, say, at Man City, they're more addicted to their job. Is there a fine line between, like, it's overboard? Like, do you mean that they're training, like, all day? Or is it that in the given time period, they're given their all, they're completely focused? What is it like?
It's not about the quantity of the training, it's about the attitude during the training, whatever it is, because of course, with the amount of games that we play, it's difficult to train a lot because we play each 3 days. Maybe the most important training is the recovery. I think that, for example, being here, players that are here are more kind to listen at our advices than the players that are in the lower teams. But this is just my experience. Maybe it's not always like that. And of course, we cannot generalize. Maybe it's just for certain players. But I've seen such a good players with amazing talent. They didn't reach the top, maybe because of this. This is just my opinion, of course.
Now, you said the players are trusting, but when you first started, how were the players towards you when it came to treatment management? Were they fairly receptive to what you had to say?
No, at the beginning I was more passive because, of course, I was just starting and I was just waiting themselves to ask me treatment or whatever. I was not going to them to say you should do this, you should do this. Then suddenly, when I became the head of physiotherapist after 8 years of my career, maybe I became too much annoying with the players because I was telling them, no, you have to do this, you have to do this. Now that after 15 years of career, maybe I find the right balance. I know how to say the things and how to take the players, and maybe I'm doing well at the moment for this.
Now, what's the key in communicating, not in so much of an assertive way, like saying, hey, you have to do this, but in a way that allows the athlete to know that it's their decision, but this is what I have to offer you? How do you actually communicate that?
First of all, it's important to build a trust relationship with the players. This is really important. We spend a lot of time with them, and the time we spend with them is in contact, because with manual therapists, for example, we touch themselves. So it's not just a communication, it's not just a speech with them, but there is also the contact. So it is important to build a trust relationship. Is not the right word because we are not psychologists, but we need to listen at them. We need to listen at them, and then after analyzing everything, maybe we can give some advices, but the advices has to be in our field. So we cannot say something that is external to our field of job. In my opinion, we should always be cautious in what we say and what we advise. But of course, in terms of our job, once we have built this relationship of trust, they will listen at us. And this is what is happening. But of course, first of all, it is important to get in contact with them.
Okay. Congrats on the Champions League final. But I know that you all still have many more goals to reach. Now, in the past 4 years, City has qualified for the Champions League, but they fell short making it to the final. This year, when that final whistle blew in the second leg match against PSG, how would you describe the emotions contained in that victory?
Yeah, it's really difficult to describe emotions, but it was to reach the final, but not just to reach the final, even to win it. It was my dream since the first time I heard the song of the Champions League. I don't know if you know, but I'm sure you, yeah. It was my dream to win this competition because it's the most important competition for football clubs. Yes, leading both games in just 6 days, it was a vortex of emotions. The first leg was difficult because in the first half we were losing and we were in difficult. We were not playing at our level, but I was feeling the anxiety in the dressing room before the game because, of course, it was already an amazing achievement, the semi-final. But then, after at the beginning of the second half, we started to play in our way, and I think if we play in our way, we are going to win it, and we did. So the second half, I was more confident, but of course, versus champions like Neymar or Di Maria, fortunately Mbappe wasn't able to play, so it was a bit easier. But still, they were a great team. So we were scared a bit, but in my belly there was a vortex of emotions for 90 minutes. But then when we scored the second goal, I was more confident, and then the watch was going fast, and finally the referee said that was over and we could celebrate this moment.
And we don't get to see the celebrations from the medical staff on the sideline on TV. What was your celebration like?
As a football fan, my celebration is maybe a bit too much for my job. I don't care a lot. I cannot keep the emotions, and I started to jump, to go in the pitch running, and sometimes you have to lead the emotion, drive yourself. Maybe most of my colleagues didn't do the same because of course, I was celebrating even with my colleagues because we did an amazing achievement, even in terms of injury record, because we arrived at the semifinal without any injury, playing each 3 days. So for us was a great goal but of course, as a football fan, I started not to dance because I'm not able, unfortunately, but to jump and to scream a bit.
Well, you mentioned that your team managed to have very minimal injuries within that 3-day time span. What do you think your medical team as a whole does exceptionally well to limit that?
Is a bit everything. Of course, the skills of the therapist. We are 8 therapists in the first team medical staff, and every one of them has got an amazing background in sports field. The skills are incredible, and everyone can do something that maybe the other cannot do. So we are really good built. They are good in something, I'm good in something else, but together we are a team, and so we can do better, because it's not just about one person or 2 people. It's about the medical team, because of course we are a team as well, like the football team. They are 11 in the pitch, we are 8 in the physiotherapy, and it's important that, for example, if one player is good to shoot the free kick or the penalties, and another one is good in the 1-versus-1, as well in the medical room, is important that one physio is good to do something and the other physio is good to do something else. Here, for example, I'm covering the position of physiotherapist, but also osteopath, and this is my main job here. So in terms of manual therapy and manipulation and assessment, of course, and I try to do my contribute to the team. But I think the goal and the achievement of the medical team in terms of injury prevention is about every one of us, the physiotherapists, but also about our communication and collaboration with the strength and conditioning coach, with the sports scientists, with the management staff, and with the players that are at the center of everything. It is important to organize well at the beginning of the season, and we are lucky because our head of physiotherapy is really good on that. When you are organized and you've got the skill and you've got a good attitude and good environment, everyone positive, bringing energy, you can reach everything.
Now, with 8 physical therapists, at times too many?
No, we are 5 physiotherapists and 3 sport therapists here in the Osteopath of the team. But we've got skills in every field. Someone is more specialized in the movement assessment and movement corrective strategies, exercises. Someone else is more specialized in the recovery. So it is important to build a medical team like that. We've got 25 players, and sometimes we also do the rehabilitation or the treatment of players of the academy. Not always, but sometimes they come to us. So even with the amount of gain, it is important that the medical staff is huge.
Now, for those listening, because there's a wide variety of people from athletic trainer, doctors, physical therapists, nutritionists, and even some just general soccer fans that are tuning in. Can you just describe your role as an osteopath and physical therapist for Manchester City? What exactly do you do?
I cover the normal pre-training and post-training activities. For example, every day we have got an organization where every one of us is looking at some players to get them ready for the training. And we get in contact with them, we know themselves, we know them, their structure, their physical structure, their dysfunctions, their past injuries. And we start to work on that in terms of treatment in the physio room, but also in terms of pre-activation in the gym. Then during the training, we used to spend the time watching the training if everyone is fit, but of course, if someone is injured or someone has got some problems, we are inside performing treatments. If someone is injured, of course, because I am physiotherapist, I used to follow also the rehabilitation, but this is not my main role here, because we've got two physios that are specialized in that. But I've done several rehabilitations during the season. During the past season, I was lucky because I did the rehabilitation of Leroy Sané LCA ligament cruciate injury, and we spent around 20 days in Los Angeles because his family is from there, and we went to LA last November before the lockdown, of course, not 3 months, not 5 months ago, the year before. And we had the chance to train at the South California University. And it was a great experience because I knew some physiotherapists from there, and I used to speak with them and to share information and knowledge. And so even performing the rehabilitation is beautiful because it brings yourself to other countries, to not just in US, because we went in US, but as well we went to the surgeon that was in Austria, and we went 3 times there. Then we went for a few days in Germany because of course for a rehabilitation of 6 to 8 months for an ACL injury, you cannot spend all the time in the same facility, otherwise it will be really boring. And it is beautiful because we had these little experiences, and that allowed myself to know something different, to view something different in terms of facilities or in terms of devices, physical devices, and everything else. My main role here is the osteopath of the team, and I used to perform assessment to all the players of the team. Based on the assessment finding, I used to plan a treatment strategy. This is maybe my personal theory, but I will try to explain to you really quickly. So the human body is a complex system. Complex system is a system that is formed by a lot of parts that are the anatomical parts with several interconnections in between these anatomical parts. And this is the human body. If you think about the human body, we've got a lot of bones, a lot of muscles, a lot of fascia, a lot of tendons, and they've got several and different relationships one each other. And when you analyze and you try to study and to assess a complex system like the movement system, the system of the players, for example, you have always to think about 2 main things that are the function and the structure. The function of the system is the way the system moves. And we've got some physiotherapists that are amazing to assess the movement here at Man City, and I learn a lot from them. The structure of the system is the situation, the position of the several parts in a specific moment. That is the assessment. And when you perform an assessment, you should be able to try to understand if there are some dysfunction in the structure, some parts that are not in the right way. And I use one unit of measures that is coming from the osteopathic field that is called somatic dysfunction. This is a concept really famous in osteopathy. And it represents a dysfunction of one anatomical part that is recognized by 4 parameters that are under the acronym TART. The first T is for tenderness, so the pain at the palpation. Then the A is for asymmetry. Then the R is for restriction of motion. And then the T is for tissue texture changes. Basically, performing my kind of assessment that I developed during my experience, my 15 years of experience in football, I perform this kind of assessment and I try to understand way the structure of the system is. So based on that, I say and I try to understand if certain players needs more treatments, more osteopathic treatment on the structure, or certain players doesn't need a lot. And based on that, I will plan my month or my weeks, and I will treat the different players. And my goal is to make the structure better to allow a better function. Because of course, structure and function are strictly interacting one each other. And if your structure is good, your function in the field and in the movement will be better. Of course, it's the same, because if we don't move well and your function is not well, your structure is going to suffer and you will develop somatic dysfunction. So it's always important to take in consideration both. And for myself, it's important to assess the structure, to tell my finding to the other physios, because we are going to analyze my findings together with their findings. Yeah. And together we are going to build a prevention strategy based on treatment on the bed, but also on pre-activation in the gym.
Now, outsiders view a team's success whether they win or lose, but as a medical provider, what does success look like for you?
It is important for us. Maybe our main goal is that the players are well, they are not getting injury, and if they get injured, they will recover in the right time or maybe faster, but I think that is important to respect the time of the healing processes, so at least in the right time, and to avoid recurrences. So this is our main goal, and maybe at the end of the season we should just analyze this, but sometimes it's not just about this in football. In football is important, first of all, that the team is going to win. And our job will have a good success just if the team is going to win the trophies or the games. Otherwise, even if we do amazing, but the team is not reaching the goals, our job will be forgotten. I remember my first season at Palermo, we had the best score in terms of injury because we had just 2 injuries during the season, but we get relegated in the second division. So at the end of the story, our job was forgotten because, of course, no one will remember the fact that we had no injury. Then the year after, we had again the best score, and the team won the league of the second division. So we get promoted in the first division. So in that case, everyone was remembering, but we get promoted because you did an amazing job.
That is so interesting. So the victory does matter in the grand scheme of things, even for medical professionals. So in that case, at times, did you ever fear, like say the team didn't do as well as they intended to do, that you may not have a job the next season? Does that ever cross your mind?
No, because it is, I think the most important things when you work in this kind of environment is your behavior. You have to maintain your role, your position, to don't pass these limits, because of course the threshold is really small. And I am a physio and I don't speak about management stuff or about how the players play, because I know that is going to annoy someone. So it is important always to keep your position, to perform your job in the best way possible, to be positive and to behave well. And at the end, even if the team is not winning, it's really difficult that someone is to Saki. You will have your job even the season after. But I mean that for a medical working in sport, even if you do an amazing performance and you get all the players fit in the right time, you don't have injuries, but the team is not successful because of other factors. Yeah, your job is still well recognized, but your job didn't help the team to reach the goal. So our happiness, of course, is to get the players fit and to let them healthy, but at the same time, working in football, it is important to win.
Okay. Now, I do want to go back to the time that you started with Manchester City in 2016. And you said that you loved your job in Italy, but you wanted to obviously keep learning. What was the application and selection process like in joining City?
Yeah, here in UK, all the teams provide on their website, on the job vacancies, an application form if there is an open job position. For me, I did the same process, but I was advised to the doctor by some players from Italy, and I was lucky because one player I worked with in Lazio was playing here for Man City, and he advised my name to the club doctor. So what happened that you have still to pass all the application form, but I had some good references from several players because the club doctors here, the club doctor is an Italian doctor that used to work in AC Milan, and I used to work with some AC Milan players, and they told me you deserve to be there. When there will be the chance, when there will be an open position, we are going to advise yourself to the doctor. So I knew that there was this open position at Man City. I did the application, I passed all the interviews and everything else, and then the doctor select myself because it was a moment of changes. Doctor wanted, before there were just English physiotherapists, but the doctor wanted to become a bit more international, and he wanted to bring some European physiotherapists. So there was this amazing chance for me. It was a dream because I wanted to work for a great team, to compete to win the Champions League and other trophies. And I wasn't sure I was ready, but I came here with a good attitude. I knew that I had to learn still a lot, and I did. In the last 5 years, I learned a lot from my colleagues here, and I'm grateful to them because when I joined Man City, I was average physiotherapist, maybe good. I don't know. I don't want to be too much, but I think that the physiotherapist I'm now is much better than when I joined here because of the skills that I learned from my colleagues, from the experience I'm leading, and from the environment and everything else. So I'm really grateful to everyone. I'm really enjoying it this time here.
That's awesome. So it sounds like for medical professionals working with even an athlete, maybe it's not on their dream team that they eventually want to be, but when you do good work with one athlete, they could be that person that then speaks on your part in helping you get your foot in the door. Would you say so?
Yeah, I think maybe it's not just one, but it's the consistency in your work. And of course, our work, we can fail sometimes, but if you can even fail, but if you are doing everything, following the evidence-based practice, following all your knowledge, respecting the player, respecting the manager, if you are a good guy and you are a good physiotherapist, people will speak good about you. I don't think it's just one person that will be able to bring you in one environment, unless this environment is maybe a small club, little club. Or if I think about my 4 years at Palermo and the last 2 years at Lazio, I think I've done a great improvement. And I was working really in a professional way, following the evidence-based practice, respecting everyone, trying to do my best, assessing, not just starting with the treatment and everything else. And I don't know, people, I started to get good relationships with players and managers. And after this, maybe someone was going to speak in a right way about me. And when there was this opportunity, they did it, and I arrived here.
So prior to Man City, despite you studying on weekends, you said that you weren't quite sure that you were ready. What were you unsure of when you started?
No, I mean, about my skill, I was ready. I was sure that my skills were enough to arrive here, but this was a big environment and different dynamics, different country, different people. It was totally different. And maybe I was thinking, okay, maybe here in Italy I am good. I be to be ready to team in Italy and to manage one staff, to take the responsibilities to rehab a player, to select the exit criteria for the return to play, to tell to the manager he's ready to play, to get my responsibility and my risk, saying to the manager and to the fitness coach, no, he can play, don't worry, he's not at risk. But it's totally different dynamic because people is different, culture is different, and the way to work is different. So I was a bit scared about this. Yes, even if I worked for Lazio, that was a good team, even a high-level team, but it wasn't the same of Man City that is competing in Champions League every year and to win the Premier League.
You have the final coming up the 29th of May. You touched upon it very briefly how you made so many sacrifices up to this point. What has been one sacrifice that was a tough one to make, but has helped you get to where you're at today?
I was already covering a good position because I was the head of medical of the physiotherapist at Palermo. That was a good team in Italian Serie A, and I was happy, of course, of my position, but I wanted to become better, to improve my skills. So even if I was working there, Palermo is in Sicily, that is a little island in the south of Italy, so it's a bit close. Most important courses in Italy are in the north or in the center of the country. So when I had the day off, instead and enjoy with the family or with my colleagues in an amazing city like Palermo with the sea and beautiful food, I used to travel to Rome or to Milan to attend courses, follow the university lessons for my master in osteopathy. To do this, sometimes I used to go to watch some amazing physiotherapists working in the country because I knew that they were really good in what they did. So I spent a lot of time trying to improve myself, and there is not just one sacrifice because we cannot say this, the sum of all this that maybe brought me here. But it's about the attitude, I think. It is important to improve every day and every day and every day. I used to spend every day at least 2 hours studying because I know that it's important to keep updating, to study different theories. I'm trying to build my theories, and I had some theories in terms of rehabilitation, in terms of assessment, in terms of treatment of the movement system. But I know that the way is still long. And
we're going to talk about later a little bit about your craziness when it comes to all the schooling you've done. But you said you were working in the Serie A, but on the weekends you were then going to courses. How did you manage to have still a life with your wife? Do you have kids at all?
Yeah, 2 kids.
Yeah, how did you make that work?
I had to ask them their understanding, and they were kind to understand me, and they keep doing. But at the moment, what I do, because I know here now we are in a different country and it's totally different because when we were in Italy, the mentality is a bit different. People is more open, used to speak with you easier. here in UK is a bit different, Once we arrive here in UK, I started to wake up in the morning at 5 o'clock, and my study time is from 5 o'clock to the moment when my kids wake up. So then I stop and I go to work, but when I come back, spend the time with my family. Otherwise, this is not life, of course. This is the most important thing. And it is important to be happy at home with the family, to perform well in the best way possible at work.
What do you and your family like to do?
A lot of things. Unfortunately, here in Manchester, the weather is not the best. I don't know if you saw, but 3 days ago when we played Paris Saint-Germain, the first half was snowing and it was May. And in the Paris Saint-Germain team, there was a player that I know, that is Alessandro Florenzi. I know himself because he's from the same area of Rome where I am from. We know one each other from when we were child. And he was telling me, how can you live here that in May is still snowing, and in Rome people is already at the sea? And so it's difficult to do a lot of things, but we like to spend time together, to play in the house. When it's good weather, we used to go, well, not now because of the COVID, but to go to the park. If it's good weather, we used to go to the park, maybe play football with my son, play baseball, or I don't know, just riding the bike. Normal stuff, nothing of particular, but just to spend time together and be happy.
Yeah, okay. Well, given that it's so chilly there, what were the streets like in Manchester City after that victory?
Unfortunately, I didn't go in the city center because of the restrictions, and I live a bit outside of Manchester. But I can just tell you that when we finished the game, of course, we started with the recovery strategy straight after the game, and we had dinner together with the players and with the staff. Then we were going outside from the stadium, but the fans blocked the gates because they were so happy, and there were around, I think, 5,000 people in the streets right outside the stadium. So we weren't able to come back at home, and we had to spend around an hour just waiting in the car, but we were singing with them and celebrating with them. It was an amazing atmosphere. This is the joy of football. Football is for people and for everyone, and it's incredible to the joy that you can give to people just with a victory. I know that is really little because we are just on the side of the player and of the manager. But
you worked for a PT at a high level, the Serie A, you worked in a World Cup, but then you decided to go into medical school. Why did you decide to make that decision?
I did it because I was passionate about football, and my dream was to work with football. And I'm not a good seller, so I cannot be an agent or for the players. I'm not a good speaker, so I cannot be a sport director. I don't understand a lot about tactics, so I cannot be a manager. I wasn't able to be a player, so the only way was to become a physio. And I had this my personal experience with the knee, Osgood-Schlatter syndrome, when I was growing up, and then this patellofemoral pain that was annoying myself for from my 15 to the 20 years. So I decided, okay, I want to help people. I want to help players to get better, to perform better, and to reach their goal. And then I started to study, and I really enjoy. And now my will is to help people in terms of physical health, to get not just the football players, but whoever I can help. Is really beautiful to give my contribute to let them feel better. So everyone that wants to become a physio has to understand that the joy and the happiness that give us the feeling to let someone else feel better is incredible, and it's an amazing job. And if we do it in the right way, we can even reach great environment like I'm doing now, my experience here. And
yeah, but Federico, why did you decide to get your osteopathic degree, even though you've had all this success? What more were you yearning for?
I was watching one osteopath working in Lazio, and I really liked the way he used to treat the players and the people in general. And I think the osteopathic vision of the unity of the body and the skills in the manual treatment that the osteopathic studies gives to you is incredible. And I knew that this kind of skills were going to help myself to reach high level. And so I wanted to attend this course that take me 6 years, but it was a great sacrifice, of course, but it was amazing. And then when you're studying this, you think, okay, but what about this? Because one guy came to our school making a seminar about applied kinesiology, and I said, oh, this is really good. I want to do this. And then I spent 2 other years to study applied kinesiology. And then, okay, but there is one guy from America that is really good in that. So I want to learn from him. So I fly to US and attended a seminar about applied kinesiology with him. And it is a will that you are always, because you build your strategy of studies even following your thoughts, because my theory is this. So to get this theory through and to get this theory be recognized, I need to study this, otherwise I cannot confirm this. And maybe you study this and you say, okay, whatever I was thinking was wrong, I need to change completely strategy, and then you go to attend another course. It's really difficult. Sometimes a lot of people ask me, what courses should I attend to become a great physiotherapist? And I say, it's difficult to tell you. I think the skills you need are these, but you are going to choose the courses and the studies in relation to your thinking about the physiotherapist and about the movement system.
Okay. And you said it took you 6 years to get your osteopathic degree. During that time, were you also still working for a football club?
Yeah. This was a part-time course. It was 3 days each 4 weeks, and it was 6 years with one full week at the end of the year. I was working, but as I told you, I started straight after my beginning at Lazio, and I finished the 6 years of Lazio. Then I went to Palermo and I get one osteopathic master at the university as well. That is a different one, but my school of osteopathy, it was 6 years, and it was during my time at Lazio, and I was lucky because I was in my own city, and my agreement with Lazio was that I was going to finish this course. Of course, at the beginning, I think when you're full of energy and when you can just sleep 4 hours per night when you're young, you have just to do whatever you can do. And I was able because I had a lot of energy. If I think now about travel and go, it is a bit more difficult, but maybe I do a bit less, but I still doing.
Yeah. I mean, I'm not that old, but I struggle some days. I'm like, ooh, I need some sleep. But for medical students right now, what can they do during their schooling and early years to set them apart when it comes to getting their foot in the door for a professional club?
Yeah, I think the best thing to do if they cannot perform because they're not still graduated, it is to go to watch the best professionals work. This is what I did. I used to email people all around Italy that I knew that maybe they had experience at the hospital, going to email people to ring the best professionals all around Italy, knowing themselves and to their facility to watch them work, because I was a young student. I wanted to improve, and you cannot, but someone else said yes, of course, strategy, because it is important to not just to attend a course, but maybe you say, I've got a lot of questions to do to this guy because it's really interesting. Maybe my advice to them is to try to have a conversation with you, a Zoom call with you. I'm always available if you want, whatever, because I really like to share my experience and my little knowledge about this, but I think it is really important, and I am grateful to the people that 15 years ago did the same for me. So whoever is trying to texting me or emailing me, I'm more than happy then to speak with them. And I think this is a good way to start.
Can you just tell me about the data analysis software you've created for professionals in the physical therapy, osteopathy, and rehabilitation field?
Yeah, it is difficult to explain you in few words, but it is. So 4 years ago, I started to think about a software. I was watching in the market about a software that was going to help myself in my job, in my daily job, but I didn't find the one that I wanted. So I said, okay, I will start to work, and I'm going to develop myself. Then, of course, I asked some help for other people because you cannot do everything by yourself. And there are some people that are collaborating with me, some fitness coach, strength and conditioning coach, psychologists, and everything else. I'm going to build a software that I think it will be revolutionary. I don't know how long it will take to be used by people, because at the beginning it could appear a bit difficult, but I think is a great idea. It's based on a body map, 3D body map, divided in several region and area, and every area has got a lot of structures, anatomical structures, and I built all the network of connection of these anatomical structures, so you can set some dysfunction, some injuries in a specific structure, and the software is going to advise yourself about all the connections in the movement system. But it's not just this, it will work like a social network, because you will be able to build relationships with your clients, with your patients. I will explain you in a different moment, because it's really difficult to explain you in a few minutes.
Yeah. It sounds complex. Will that eventually be available worldwide?
Yeah. I have developed this in Italian language for facility because the developers are in Italy, but in a few weeks I'm going to translate in English and in Spanish, and then maybe in Portuguese and French.
Well, what are the last final words that you can leave someone when it comes to pursuing all that you want in this life?
Just look forward, step by step, head down, work, and be positive, be happy, and step by step we can reach everything without any doubt. Don't think that you cannot reach any level of your profession. I think if you get in your mind and you just go around and face all the difficulties and sacrifice for what you want, for sure you will reach what you want.
Well, thank you so much, Federico, for your time. It's been such a pleasure, and certainly best wishes on the remainder of the season. And I certainly hope to connect one of these days in the future.
Of course. Thank you very much. Thank you very much.
And that was Manchester City's osteopath and physical therapist, Federico Genovesi. Be sure to download, rate, and share with your friends, because the episodes will only get better. Check you later next week.